teaching people how to control their pain, their stress, their anxiety, their insomnia, their habits is something that the brain does best. And if you can teach them to use their brains better to do it, from my point of view, that's a superior treatment.
So off the bat, how can hypnosis help heal our minds, stop negative thoughts, and find motivation?
Well, hypnosis is the oldest Western conception of a psychotherapy. It's the first time that a talking interaction between a doctor and a patient was thought to have potential benefit. And what it is simply a narrowing of the focus of attention. So what you concentrate on, you concentrate intently. It's like, have you ever had the experience of getting so caught up in a good movie that you forget you're watching the movie and enter the imagined world?
Yeah, one of my favorite feelings ever.
Right. So you get fully absorbed, but you put outside of awareness or dissociate things that might otherwise distract you. And that's a kind of automatic self-hypnosis when you go into a state like that. And the third component is what we call cognitive flexibility. You're more willing to take on uncharacteristic or unusual situations and try them out, see what they feel like. You kind of disconnect from your ordinary way of being, which people used to think of as suggestibility, and it scared them. They thought that the hypnotist could take control over them. It's really a state of mind that allows you to increase your control over mind and body.
That's counterintuitive, because when I think of hypnosis, or at least the way that it's been presented in pop culture, we all have seen movies where hypnosis is occasionally involved. It seems like the opposite of that. Like, you've left your body. It's like it's a dissociated state.
Well, it involves dissociation, sure. In order to focus intently, you put outside of conscious awareness things that would ordinarily be in consciousness. Now, right now, you're sitting on a chair. There's sensations in your body touching that chair, but hopefully you were not even aware of them until I brought it to your attention. If you are, we can just stop right now. So we do it all the time. In the service of attending to some things, you dissociate awareness of others. But that's a process that's in everyone's control. They decide what to do. And hypnosis is really a way of enhancing control over mind and body, not losing it.
That is fascinating. When it comes to that sensation that we get in movies of being lost in the film, or even a good song, how does that differ from when hypnosis is being used therapeutically in the clinical setting?
Well, because in the clinical setting, you're using this intensity of concentration and capacity to dissociate and see things from a different point of view for a therapeutic purpose. So, for example, let's say you're in pain. I had a woman who was 7 months pregnant, had very bad lower back disease. They couldn't give her medication because she was pregnant. And the heavier the baby got, the bigger the baby got, the more her back hurt. They implanted a nerve stimulator. It didn't work. So I had her imagine doing the thing that she actually finds relieves her the most, which is being in a nice warm bath, and let the warmth filter the hurt out of the pain. The strain in pain lies mainly in the brain. The brain decides how to interpret those signals. And there are real nerve pathways that convey pain signals to the brain, but then the brain has to process it. And so what she was learning to do is filter the hurt out of the pain by imagining she was feeling sensations of warmth and comfort. And her pain went from 7 out of 10 to 3 out of 10.
Wow.
And when she opened her eyes, she looked angry. And I said, "What's the matter?" She said, "Why in the hell are you the last doctor I got sent to instead of the first?" So, we tend to think in medicine, we treat bodies and people as if they were automobiles, just replace the part, injection, ingestion, or incision. But in fact, the brain has an enormous amount of control over our level of pain, our tension, anxiety, our ability to sleep, our ability to control habits. And hypnosis is a powerful way of engaging that ability and taking advantage of it.
How is it done? I mean, insofar as you can describe it to my audience. Again, I mean, I go back to how I perceive it to be achieved from what I've gleaned from pop culture, which is like the dangling clock, right?
Yeah, the dangling. We don't, digital watches don't dangle very well, so we don't do that. If people want to know, we've developed a digital interactive hypnosis app called Reverie, like the dream without E at the end, Reveri. It's downloadable at the App Store or from Google Play if you have an Android rather than an iOS phone. And we can teach anyone to do it. That's why we developed Reverie, to help people with the kinds of problems I've discussed by using hypnosis by themselves. And we've had many, many thousands of people doing that. There are lots of ways to do it. The way I do it there is to teach people to get comfortable, look up, close your eyes, take a deep breath, let the breath out, let your eyes relax, but keep them closed, and let your body float. Imagine you're floating in a bath, a lake, a hot tub, or floating in space. And then I usually ask people to let one hand feel light and float up in the air like a balloon. That's a signal to themselves that they're ready to concentrate. There are lots of ways to do it. There's nothing sacred about that, but it's quick. It's much quicker than people usually expect. They expect to be counting upstairs and downstairs for 20 minutes, and you don't have to do that. You can just, if you've got the ability, you can just shift gears and do it. And so on Reverie, we have a hypnotizability test. So in 5 minutes, you can learn how hypnotizable you are, what the nature of your hypnotic response is. We have programs to teach people how to control their pain, manage stress better, get to sleep better, control habits, stop smoking, control drinking, to eat more sensibly.
Wow.
There are a lot of things that we can help people do. And I've used hypnosis with about 7,000 people in my career. That's a lot of people. I feel good about that. But it occurred to me that we know so much more about hypnosis and how it works. I want anybody to have access to it. And now anybody with a smartphone can help me get them to sleep without my actually being in their bedroom.
Is hypnosis the same for everybody, or do individuals experience it differently based on, I don't know, brain structure, personality?
Good question. Yes, we've done functional magnetic resonance imaging studies on people who are high and low in hypnotizability. Hypnotizability is a very stable trait. Once you're an adult, it's as stable as IQ over a 25-year interval.
Wow.
But most children, most 8-year-olds are in trances most of the time. It's a childlike way of being in a sense, because you get totally absorbed. With kids, work and play are all the same thing. You know, it's a shame we try to make them into little adults because they get completely absorbed in what they're doing. Over adolescence, some people lose varying degrees of that ability, and we can test it. So yes, people who are extremely hypnotizable, they just go for it. They're in it. So you can quickly say, instead of fighting smoking, just think of your body as if it were your baby. Would you ever put tar and nicotine into the lungs of your baby? Well, your body is as dependent on you as your baby is. So for my body, smoking is a poison. I need my body to live. I owe my body respect and protection. And some people just internalize that very intently. And I had one woman, she was terrific, a social worker who she said, I didn't even want to stop smoking. I was 25 years I've smoked. My friends all knew how much I liked to smoke. And the first time she tried it, she didn't like it especially. That night, she went home, tried it again. She lit up a cigarette and she said, who needs this? She hasn't had a cigarette since. She surprised herself. Her friends could not believe it. And she said to me, Dr. Spiegel, this is some kind of crazy ass voodoo shit. And I mean that in a good way. And she's now going around getting her friends to stop smoking. So some people who are highly hypnotizable like that, they just get it and they do it. People in the sort of mid-range, it's more of a negotiation. You kind of talk a little more about what the theory that you're focusing on, what you're for, not what you're against. You don't, the more you fight smoking, the more it fights back. The worst thing you can tell someone is don't think about purple elephants. You know, what are you thinking about?
Purple
instead, you're focusing on respecting and protecting your body and on intermittent positive reinforcement. That's the best way to change behavior. Rather than telling people, don't do this. You know this if you have little kids. Don't do it, they do it. But if you pat them on the back and give them a popsicle when they do something good, boy, they're going to do that again. So you tell people, look, instead of feeling you're depriving yourself of a cigarette, feel good, pat yourself on the back for being a good parent to your own body. And you can feel good, not deprived. For people on the low end of hypnotizability, it's much more that kind of discussion with less of the intense change in mental state. But all three types of people can respond to techniques involving hypnosis.
Is it fair to say that if you've ever been lost in a movie or in a song, that the potential is there for you to be hypnotized therapeutically?
Well put. Yes, that's well put. That's exactly right.
Wow. And that's pretty much every human. I mean, we have an innate need to be told stories and to get lost in story. And and so
that's how we learn. That's how we attend. We learn better when we're sort of deeply engaged. And that means being emotionally as well as cognitively engaged in a situation. And that's what stories do. You know, it's not just an abstract description of something. It's picturing somebody embarked on a journey and having experiences that begin to draw you in. So you're having a synthesis of your cognitive and emotional experience, and that gets you more focused.
I love it. What sparked your interest in studying hypnosis?
Well, it's kind of a genetic illness in my family. Both of my parents were psychiatrists and psychoanalysts, and they told me that I was free to be any kind of psychiatrist I wanted to be. So here I am. In addition, my father was taught hypnosis as he was going off to combat in World War II. He was a battalion surgeon in North Africa. And a Viennese refugee named Gustav von Aschaffenburg was a forensic psychiatrist who had a smallpox scar on his forehead. And he noticed that soldiers, the prisoners he talked to, they'd close their eyes and nod off. And he learned that he was unwittingly inducing hypnosis in them. And he could not serve in the US Army because he was still a foreigner, but he volunteered to teach young Army doctors how to use hypnosis. So my father used it to help people control pain, to help them deal with combat stress, trauma. And he found it very helpful. He came back and finished his training in psychoanalysis, but over the years, he found out that he was helping more people in a much shorter time with hypnosis than he was doing psychoanalysis. So gradually he shifted his training, and the dinner table conversations were pretty interesting, and I got to watch him make movies of patients inducing hysterical seizures in them and teaching them to control them. And so when I got to medical school, I took a course in hypnosis. I figured I need to learn this, right? And my first patient, I was at Children's Hospital in Boston, and the nurse said, she's in status asthmaticus, she's in room 342, and I could follow the sound of the wheezing down the hall. I walk in the room, pretty 15-year-old redhead, bolt upright in bed, knuckles white, struggling for breath. She'd been twice unresponsive to epinephrine under the skin. They were considering general anesthesia and starting her on steroids. I didn't know what to do. But I had started my hypnosis course, and her mother's standing there crying. And I said, would you like to learn a breathing exercise? And she nods. And I said, okay, I got her hypnotized. And then I realized we hadn't gotten to asthma in the course yet. So I came up with a very clever, subtle instruction. I said, each breath you take will be a little deeper and a little easier. And within 5 minutes, she's lying back in bed. She's not wheezing anymore. Her mother stopped crying. The nurse ran out of the room. My intern comes looking for me, and I figure he's going to pat me on the back and say, what'd you do? He said, the nurse has filed a complaint with the nursing supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent.
Whoa.
Now, Massachusetts has a lot of dumb laws, but that's not on the list. And her mother was standing next to me when I did it. He said, well, you're going to have to stop doing this. And I said, oh, really? Why? He said, it's dangerous. I said, you're going to give her general anesthesia and start her on steroids, and this is dangerous, talking to her? So I said, I'll tell you what. Take me off the case if you want, but as long as she's my patient, I'm not going to tell her anything I know is not true. So he leaves. Over the weekend. He and the resident and the chief resident and the attending had a council of war, and they came back on Monday with a radical idea for Children's Hospital. They said, let's ask the patient. And she said, I like this. Now, she had been hospitalized every month for 3 months in status asthmaticus. She had one subsequent hospitalization, but went on to study to be a respiratory therapist. And I figured that anything that could help a patient that much, that fast, that safely, violate a non-existent law in Massachusetts and frustrate the head nurse had to be worth looking into. So that convinced me I've got to do this. And so that was my first of some 7,000 patients that I've worked with since then.
That's incredible. What an incredible story. Why do you think these more, dare I say, holistic healing methods seem to be within the walls of the medical establishment so at odds with pharmacology? Is it just because it's, they don't enrich the pockets of big pharma, or is that too conspiratorially minded?
Oh, no. You don't need meds for your conspiratorial thinking. You're absolutely right. Now, I'm a physician. I use medication. There are times when it's the best thing to do. But there's this fundamental prejudice that the real interventions are injection, ingestion, or incision, that you do something to the machine and then it'll have some other effect. And in fact, our major evolutionary advantage is this 3-pound organ at the top of our bodies. that connects with every part of the body, controls, regulates every part. It's like, driving a car without using the steering wheel. It does not come with a user's manual. And so we don't take full advantage of what our brains can do. And yet, because it's talking, it's not doing, people don't think it has any effect. And that's just flat out wrong. So there are times when meds are the thing to do, and I do it. But there are times when it ought to be, as my patient said, the last thing you think of rather than the first. And teaching people how to control their pain, their stress, their anxiety, their insomnia, their habits is something that the brain does best. And if you can teach them to use their brains better to do it, from my point of view, that's a superior treatment, better outcome, fewer side effects. However, you don't see any detail people in doctors' offices telling them how to use hypnosis. No, you have them show the latest patented medication that you can sell and make big pharma a lot of money. So, it's not that drugs are bad per se. They have their place, but so does teaching people to use their brains better.
Have you, since you began down this path, have you seen hypnosis gain broader adoption within the medical establishment?
No.
When
I started my career, I thought, build it and they will come. Publish enough good, rigorous scientific research about whether hypnosis works or not, randomized clinical trials. We've done that. We and many other colleagues. It's not just me. I thought, show the mechanism. How does hypnosis work in the brain? So we've done published functional MRI studies showing how the brain changes when people go into a hypnotic state. We've been able to show that you turn down activity in what's called the salience network, the anterior cingulate cortex. When you hear a loud noise, it causes you to, it's a pattern matching system that says there's something going on out there. And these days in the United States, it's probably a gunshot and you better pay attention to it. You turn down activity in that region so that you're less likely to be distracted by things that would otherwise co-opt your attention. We increase connectivity between the executive control network and a part of the brain called the insula, right smack in the middle, that is a mind-body conduit. So it allows you to better control what's going on in your body and also to be more aware of how your body is feeling. We call it interoception, very important. And the third thing is you disconnect the executive control network from what we call the default mode network. That's in the back of the brain, the posterior cingulate cortex. And that's the part of your brain where when you're not doing much, you ruminate about who you are, what people think of you, what kind of person you are. And if you disconnect from that area, that's what frees you up to be more cognitively flexible, to say, well, I don't usually do this. Normally, if I'm in pain, I have to get a shot or take another pill. And maybe I could be the kind of person who could just turn down the dial on the pain and be able to live with it, not get angry at it, but feel compassion for my body and learn how to comfort it the way I would comfort a child. And so we know those things happen. We've shown it, as others have as well. And yet, the interest in medicine, the number of schools that teach hypnosis, the good medical schools teach it, but most don't. And it hasn't changed. And that's why I started Reverie. I got together with a Stanford Business School grad and who offered to help me we first did the app on Alexa, because it has very good interactive speech. So we thought, this is it. I don't want to just have some boring tape out there. There were plenty of those. It's interactive. So I say, well, is your hand floating in the air? And if they say yes, I go on to something else. If they say no, we say, well, I'm going to help you get your hand up, and then we're going to do something else. So it's interactive. It's like being in my office where we have that kind of discussion. And we just decided to try it. And it was a little clunky, but it worked. And then we decided to do it right. We need to build our own app. So we hired some bright young Stanford students and got some other engineers. And we put together an app that I think is pretty sweet. It is accessible. It's clear. In 10 minutes, you can tell whether you're going to reduce your stress or your pain levels. And we find that 9 out of 10 people feel better within the first 10 minutes that they start using it. And so there aren't many treatments where you will know right away whether it's going to help you or not. And if it doesn't, the worst thing that happens is it doesn't work. But for most people, it at least is helpful. And so I wanted anybody who wants it to have access to what we've learned about helping people with hypnosis. And I got tired of waiting for the profession to wake up and do it.
Yeah, I get it. What's the relationship between hypnosis and meditation? Is meditation essentially self-hypnosis?
Meditation is a bit different. It's similar. It's also an altered mental state, but meditation is Eastern, and the idea is to switch from doing to being, to just go into a state where over time, it's usually about a half an hour at least, you let feelings flow through you like a storm passing by. So you have what was they call open presence. You're not controlling it, you're just letting things happen. You're not trying to interfere with them. The second thing is what they call a body scan, where you check out different parts of your body, which is hypnosis-like in a way. And the third is develop compassion for people. And that's a good thing. And we focus on that too. But here's the big difference. Hypnosis is intentional. It's doing rather than being. You're using your focused attention to solve a problem, to handle stress better, to control pain, to get to sleep, to control your impulse to smoke or drink too much. And so it's a Western thing, not an Eastern thing. And it started in the West. Meditation, mindfulness is part of the Buddhist tradition, started in the East. It's good, it's interesting. What happens in the brain in meditation is different in that you just turn down activity in the default mode network. So you just stop, and that's what you're supposed to be doing. Get over yourself. Don't think about things in terms of yourself. With hypnosis, you kind of suspend the connection between what you're doing and who you are, but you're not trying to get over yourself, you're trying to use it. So hypnosis is rapid, brief, and functional. It's for a purpose, to do something. I don't want a bunch of people walking around feeling like they're hypnotized all the time. Although, frankly, it's a pleasant state to be in. You're absorbed, you're engaged. It's not bad, but that's not my goal. My goal is to learn to use it to help yourself live better and feel better.
I love it. What proportion of the population would you say is hypnotizable?
Among 8-year-old children from 5 to 10, like more than 9 out of 10. But in adults, it's about 2/3 who are at least somewhat hypnotizable. About 15% of them are extremely hypnotizable, and a third aren't very hypnotizable.
Interesting. Super, super interesting. Yeah, I mean, I've never been hypnotized other than that sensation of being lost in a movie. And so I'd be very interested to see how I respond to something like that.
All right. Well, we can try it if you want. You want to try it now? We can do it.
You can literally try it with me via Zoom.
Absolutely. I do it all the time.
Let's do it. Let's freaking go. Yeah.
All right. Get as comfortable as you can. You have an armrest on your chair?
Oh, man, I don't. I can let my arms hang, or I can put them in my...
rest them on your desk there in front of you. That's fine.
Okay.
All right, good. So get as comfortable as you can. Are there any particular issues you're interested in working on?
Oh, man. I have like low back issues. I have low back issues. I feel like I've tweaked a muscle maybe in my like upper back as well. I work out a lot, so
you work out a lot, so that
tweaking things is like par for the course.
On a scale of 0 to 10, how bad is the pain right now?
It's mainly in my lower back. I can feel it, particularly when I'm like sitting in this chair. Yeah, it's probably like a 5. Yeah,
5. Well, that's bad. It's interesting. People do not easily convey how much pain they're in, and that's one reason doctors often don't take it seriously. I would, if you said after my talking with you, if you said to me, what's your current level of pain while you're talking to me between 0 and 10, I never would have guessed 5. And what happens is that people either underestimate how much pain people are in, or sometimes patients just lose it and get really wild and angry and upset, and then they overestimate it. Most time, people do not easily convey how much pain they're in. Is there some physical remedy you use to help with the pain? A warm bath or an ice pack, or
ice, cold, cold water immersion.
There you go.
I do that a lot. I generally just feel like movement and strengthening my core has been the most effective.
That's good. All right, you and my friend Andrew Huberman do cold baths, right?
Yeah.
Okay.
Sort of a trend these days, I guess.
All right. Well, let's get as comfortable as you can, and we'll see what we can do. Okay. So on 1, I'll ask you to do one thing. Look up to the top of your head. Keep your chin down, but look up. That's it. Way up, high as you can, past your eyebrows. And 2, as you look up, close your eyes. Keep your eyes up, but close. And 3, do 3 things. Let your breath out, let your eyes relax, but keep them closed, and let your body float. And then let one hand or the other float up in the air like a balloon. And that'll be your signal to yourself and to me that you're ready to concentrate. Each breath deeper and easier. You may have to help it to get it started, but just let your hand float up in the air. You can bend your elbow and help your hand float up in the air like a balloon. Good, all the way up. Good. Now you can either leave your arm like this or bring your elbow down to your side so that it's just your hand floating up in the air, whatever feels more comfortable to you, but keep your hand upright. And I'm going to give you this instruction. Your hand will remain light and in this upright position even after I give you the signal for your eyes to open. Later, if I ask you to take your left hand and put your right hand down and then let go, it will float right back up to the upright position. You'll find something pleasant and amusing about this sensation. Later, if I ask you to touch your right elbow, your usual sensation and control will return. Now, right now, we're going to come out of the first part of the hypnosis by counting backwards from 3 to 1. On 3, you'll get ready. 2, with your eyelids closed, roll up your eyes. 1, let your eyes open. 3, 2, 1. That's it. Just open your eyes. Good. And describe what physical sensations you're aware of now in your right hand and arm.
It feels, like I'm not exerting any effort to keep it here.
Aha. So is it comfortable?
Yeah.
Any tingling sensation?
Not a tingling sensation, but yeah, it feels, it feels like effortlessly kind of stuck in this up position.
Good. Does that surprise you at all?
Normally, I feel like my hand would get tired.
Does your right hand feel as if it's not as much a part of your body as your left hand?
Yeah, a little bit.
All right, there you go. Dissociation. So now take your left hand, please, and pull your right hand back down and then let go.
Pull my right hand.
And then let go.
Yeah, it still feels like I feel a little bit dissociated from it.
So turn your head, look at your right hand, and watch what's going to happen.
Okay, I'm looking at my hand.
And while you're looking at it, just imagine it to be a big, buoyant balloon. Can you describe what that feels like?
It makes my hand feel really light.
Okay. So while you're imagining it to be a balloon, permit it to act out as if it were a balloon. Be big about it. I can't see it, so can you tell me what's happening?
Yeah, it's weird. I'm putting all this attention on it.
Right, right.
I've never put so much attention on my hand before, and it's starting to like look funny, but
Interesting.
and it feels very light.
Mhm.
It feels sort of like when you say a word that you say, like a word that you just say, but then you like actually focus on how weird the word sounds.
Yeah, yeah. All right, so just let it float up, all the way up.
Okay, this is back where it was.
Now, by way of comparison, please raise your left hand. Put your left arm down. Are you aware of a relative difference in sensation in your right hand going up compared to your left?
Yeah, I feel I'm more in control of my left hand, whereas
More
my right
control. Good.
hand feels like tingly is not the right word. It just feels like yeah, like I've been like sleeping on it, so I have less sensation in it.
Got it. All right, now take your left hand and touch your right elbow. And then let go. Now I notice you put your right hand down. What happened there?
Yeah, I feel now it feels like it's like equilibrium.
Equilibrium. Okay, good. And do you know why that happened? Did I do or say anything that would indicate?
It feels like it was in my head. It wasn't, it feels like I was focusing on it, and the way that a word loses its meaning and sounds like a weird alien thing, a word that you've said a bajillion times in your life before.
Mm-hmm.
I obviously interact with my hand every day,
Sure.
but it took on a new character once
Right.
I started to put that kind of, the feeling, my connection to it took on like a different, like dissociated character.
Well, does it still feel light now, or does it feel equal now with the left hand again?
Now it feels like equal.
Did I do or say anything that would indicate there'd be a change in sensation or control in your right hand and arm?
No, but I put it on the table, and it felt like, maybe like blood flow was going back to it, or it grounded to the table in a sense.
Did I say anything to you about your elbow or touching your elbow?
Other than telling me to do it, no.
Did you touch your elbow?
Yeah.
Okay. Did you have a sense of floating lightness or buoyancy in your right hand and arm during the test?
Yeah.
Did you have that sense in any other part of your body?
No.
Just
No.
okay. So I just did a brief hypnotizability test, the kind people can undergo in reverie, and your score is 8 out of 10. You're quite hypnotizable.
Interesting.
How would you rate your pain right now on that 0 to 10 scale?
Right now, 0. Yeah.
I love it. What do you make of that?
I mean, it completely, yeah, I took my brain off of it and
Right.
took my mind off of it. I don't even know if that's it. I just don't feel it at all right now.
I love it.
Yeah. That is weird. Yeah, I don't feel my back at all, like the pain.
Exactly.
Whereas I definitely felt it
Pre.
hypnosis.
So you have to pay attention to pain for it to hurt. It's both a combination of physical input and how your brain responds to it.
Wow.
And your brain, you can learn to just turn it off. You're very good at it. You're very hypnotizable. There you
Damn.
go. I love it.
Yeah, my back feels really good right now, actually.
That's great.
So
Good.
I can use the app and I can do this to myself every day.
You bet. Absolutely.
Wow.
Absolutely. Just download Reverie and do it. That's exactly right.
Okay, so walk me through what just happened
All right.
in my brain.
In your brain. So you turn down activity in the salience network, in the part of the brain that is monitoring signals. And one thing that would occupy your salience network is some of those pain signals. And, oh, my back, and how long is this interview going to go? And do I have to keep sitting here like this? You're not thinking about that at all. You're narrowing the focus of attention. So you're attending to a competing sensation in your body, which is what was going on with your right hand and arm, where you don't happen to have any pain. So your brain is deciding those pain signals are not worth attending to. The brain treats most pain as if it were acute pain. If you just broke your arm or damaged your knee, you better do something about it. Or if you're having crushing chest pain, you better do something about it. But most pain, it doesn't matter what you do. Your body is dealing with it. It will heal, and you don't need to pay attention to it. But the brain is trained, because we're fairly vulnerable, fragile creatures. We don't run that fast. We don't see that well. We don't hear that well. We better attend when we're hurt. And so evolutionarily, that's part of what we've learned to do, but you don't need to do it. And so when you focus intently, you're turning down that salience network. You're connecting intensely between your executive control region and the frontal cortex and the insula. So you're saying, I want to use the insular resources to figure out what's going on in my right arm and hand. And I'm going to turn off the input that comes from my lower back. It's just not important. And your brain can do that. And the third thing is this sort of sense of wonder you have at the end. my God, what just happened, is because you were disconnecting from your self-monitoring network that says, well, usually when I'm sitting here this long, my back hurts. And you're just saying, I'm not going to be that person. I'm going to try being someone who can just focus on one thing and turn off the rest. And you did.
Is there, I mean, it's amazing. Is there an enduring like effect that this has? Like, will this effect endure?
From now on, you're going to be a much finer person. Absolutely. We did one randomized controlled trial with women with metastatic breast cancer. They get pain because they have metastases in bone when the disease spreads. And we taught them once a week how to do self-hypnosis at the end of group therapy. And by the end of the year, they had half the pain the control group did on the same and very low amounts of pain medication. So the answer is yes, because they learned to do it for themselves. You know, when they felt the pain in their chest, instead of thinking, oh my God, the cancer's spreading, this is horrible, and therefore paying more attention to it, they said, oh, I know what this is and I know how to control it. And they do that. So yes, it can, you got to keep doing it, but it's there. You've got it. You can use it.
Interesting. Yeah. The back pain went away. Yeah. Is it, I mean, and it's not just because you distracted me from it, right?
Yeah, no, because it's, you know, it's been a while now and your pain is still not there.
Yeah. It's not there anymore. That is super interesting.
Well, I'm glad.
Yeah. Pain. Is that when looking at the totality of evidence, would you say like, where is it, what category of conditions is there the strongest degree of evidence? Is it for pain?
Very strong for pain, yes. And it's been used for hundreds of years. Prior to ether anesthesia, there was a Scottish surgeon named Esdale who went to India and used hypnosis as the only anesthesia for amputations.
Wow.
Before, they would just hold people down and force alcohol into them, and it was horrifying. And he just used hypnosis. And when ether was introduced at Mass General, the surgeon strode to the front of the auditorium and said, gentlemen, this is no humbug, to distinguish ether from hypnosis. Well, Esdale actually withdrew his paper because he said, well, I was only getting 80% surgical anesthesia. They reported 90% with ether, so I quit. And it's taken us more than 100 years to figure out that the brain has something to do with pain and can learn to control it. And it's a shame because you just felt it. And so pain is a well-established example. We've done randomized controlled trials published in the Lancet, the leading British medical journal. 241 subjects undergoing arterial cut downs. You don't use general anesthesia for that, but it hurts and they're anxious. You're zapping tumors in the liver, or you're doing imaging of artery stenosis. It takes about 2.5 hours. One group got, everybody got a button they could push to give them IV opioids. Second group got a friendly nurse comforting them, plus that. And the third were taught self-hypnosis. After an hour and a half, the average pain level in the standard of care group was 5 out of 10, like yours, just like yours. It was 3 out of 10 for the ones who were being helped and comforted by a nurse, and it was 1 out of 10 for the hypnosis group. And they were using half as much opioids as the standard care group. They had fewer procedural complications by far, and they got done 17 minutes quicker, just because not only were they not so uncomfortable, but the medical staff wasn't either. This guy isn't struggling and suffering. We looked at anxiety levels too. The stress levels were 5 out of 10 for the standard care group, 3 out of 10 for the nurse, and 0 for the hypnosis group. I was afraid they died or something. They were just so comfortable. So, and we published that in the Lancet, randomized clinical trial. If that was a drug that I was using, every hospital in the country would be using that drug now. More comfortable, 20% of the pain, no anxiety, get done quicker. It actually saved $338 a procedure because they were shorter. If that were a drug, everybody'd be using it, but it wasn't a drug. It was teaching people hypnosis. And that's part of what made me decide that, you know, enough proof already. Let's just get it to people where they can use it.
Incredible. I mean, also today we live in a time of such abuse with regard to opioids. So many people left and right I mean, it's like a real epidemic of opioid abuse and opioid deaths due to opioid abuse.
You're exactly right. We have lost about 300,000 Americans in the last 10 years due to opioid overdose. Remember the wonderful performer Prince, a fabulous singer and
Of course.
guitarist. He had a lot of injuries from doing all kinds of acrobatics on the stage. He was on opioids. He took some one night, went to sleep, and never woke up. He wasn't trying to kill himself. He was just a brilliant, charming guy. And the problem is that opioids affect two different receptors on nerves. One is for pleasure and pain, so it can turn down pain, increase pleasure. The other controls respiration. It's a different receptor. And people habituate, they get tolerant to the pleasure and pain one, but not to the inhalation one. And so what happens is they think they can take more because the pain's getting worse and they need more to control the pain. And they just stop breathing. They go to sleep, and the drug inhibits their respiration and they die. 300,000 people, most of those are not intentional suicide overdoses. They're just people who don't realize that they're taking too much. And now with fentanyl and carfentanil, which is like 100 times more potent than morphine, it's much worse. These teenagers, it just breaks my heart to see them take these drugs. They just lie down and die. And it's horrifying that people are poisoning their bodies with these overly potent drugs and not doing simple things like this that they could use to control pain and stress and anxiety.
And the majority correct me if I'm wrong, but they're legitimately prescribed, right?
Yes, they are. Well, that's, there were these companies like Purdue Pharma that was trying, heroin was considered a lower class poor person's drug of abuse, right? And if they had places, needle shelters and places where people could take the drug supposedly safely, they were in, ghetto areas in town and things like that. What Purdue did is they came up with the idea of making it cool for wealthy upper middle class people to use drugs like this. And so they got them to take these drugs. They got doctors to, by law, have to ask people how much pain they're in. And I do, I'm a doctor, but it got them also to overprescribe OxyContin and other drugs like that and get people addicted. And they taught me in Harvard Medical School, they taught me that only street junkies get addicted to opioids. People with real pain don't. That's what I was taught in my pharmacology class. It infuriates me because, in fact, it's the opposite, that people get withdrawal hyperalgesia. So you actually get more sensitive to pain if you keep taking opioids. They do help acute pain. So if you're badly injured, you take it for 3 days and stop, you're okay. It is terrible for chronic pain. It just gets people addicted. They want more and more, and it doesn't continue to help the pain in the same way, but what it does is gets people addicted and makes them hyperalgesic, more pain when they try to stop. So it is a horrible, damaging, dangerous thing to do.
Damn. Yeah. Wow, that really sucks. So pain.
Yeah.
I mean, this is a really great option.
Yeah.
Are there any risks? Any potential for adverse effects with hypnosis?
I've had an occasional person get upset. People go into hypnotic-like states when they've been traumatized. So I had some woman have a sort of hypnotic hallucination that her husband was being pulled off a donkey and harmed. I talked her through that. We have used it now with many thousands of people. I was a little nervous when we started Reverie. I'm out there hypnotizing people I've never met and never will meet. And the number of so-called complications I can count on the fingers of one hand. And they were all relatively minor and dealt with easily. There were a few people that felt more anxious instead of less anxious. But that's about it. It's surprisingly safe compared to any drug. Very safe.
Can it be used for issues related to mental health? I mean, pain, I think
absolutely.
Pain, I think, is
Well,
right there,
yeah.
that's incredible. But yeah, we're also in the midst of a mental health crisis.
We are, and it's very helpful for stress and anxiety. You can teach people using hypnosis to dissociate their physical reaction from their mental reaction. One of the reasons that panic attacks happen is that people are worried about something, and then they notice their body tensing up. Their muscles tighten, they breathe faster, they start to sweat, and then they think, oh my God, this must be really bad because my body feels so bad. And so then I say, okay, First thing you do is take care of your body, and then we'll get to the stressor. So, because it's like a snowball effect, it's like a snowball rolling downhill. It just builds. So it gets your body. So imagine you're in a bath, a lake, a hot tub, or floating in space. Let your body float, feel comfortable. Now picture in your mind's eye an imaginary screen. You can either picture someplace where you naturally feel comfortable and safe, like a beach or a mountain meadow or something. Notice how quickly and easily you can use your stored memories and your imagination to help yourself and your body feel better. Well, they're already feeling better because the power of whatever that stressor out there is has been reduced because your body doesn't feel so bad. And then you say, okay, so I get anxious every time I step into my boss's office. What am I going to do? So I say, picture that, but keep your body comfortable. And then on the other side of the screen, picture one thing you can do or say to make the situation better. So it may be acknowledge, say, I'm sorry, I did make a mistake. I won't do it again. Or please don't talk to me like that. I don't deserve it. Whatever you think is the right thing. But you can now think more clearly about how to handle the problem without getting all caught up in how bad your body feels. For people with problems like airplane phobias, we teach them to go into a state of self-hypnosis on the plane. Rather than fighting the plane, float with the plane. Just buckle yourself in and enjoy the movement of the plane. And then think of the plane as an extension of your body. It's you're not flying on some rot gut airline with a drunken pilot. You're flying on a standard airline with well-trained pilots and safety procedures. Think of the plane as an extension of your body, the way a bicycle is. If you want to get somewhere faster, you ride a bike. It's an extension of your body. You're designating the pilot to be your agent, to get you safely from one place to another. You're not out of control, you're in control. And so things like that can help people deal with established phobias, with fears of getting in airplanes, crossing bridges, going outside, whatever it is. And we find, we just had a terrific Texas musician. He's up on the website now, who he had panic disorder. He had what we call agoraphobia. He was just afraid to go out of his house. And that's not good for a performing musician. And I just had him imagine he was floating, and he used Reverie. He used the stress reduction app. And he said, I'm out in the world again. I feel terrific. I got my life back. And it was just from using the app. So there are people, it's not a treatment, it's a health skill, but people decide what their problem is and see what they can do about it. And when you think about the fact that most people with mental illness never get to a mental health professional, a psychiatrist, psychologist, or even a physician, more than half of all people with depression are treated by primary care docs, and they're terrific, but they're not mental health specialists. So there are a lot of people out there who are not getting access to any kind of mental health treatment. And this is a way of at least teaching themselves skills to better manage problems like pain and stress and anxiety.
Yeah, PTSD, in my view, would be a perfect candidate for treatment with this.
Well, you're right. I treated a woman remotely, by the way. A lot of my patients until recently I've been treating remotely, who came from a country that you would recognize, but I won't tell you what it is, for mistreating women, you can guess. And she was depressed. She finally got out of that country. She said, I would walk around as a teenage girl and my body wasn't my own. Men were free to say anything they wanted to me. It was horrible. It turned out she was raped at age 12 by their landlord, and the family was afraid to do anything because they were afraid they'd be kicked out. And she finally got out of that country, came here, became a healthcare professional, but was chronically depressed and retired early. And I got her hypnotized, and I said, I want you to pretend you're your own mother. And I want you to picture yourself as that 12-year-old girl just after you've been raped. And she started to cry. And I said, tell me one thing. Is this her fault? And she started crying harder. And she said, I'm stroking her hair. I'm stroking her hair. No, it's not her fault. And so she came out of the hypnosis. We talked about it. And she had carried this burden throughout her adult life of feeling that somehow she was to blame. And many rape victims feel that somehow I should have known better than to walk through the park to the pharmacy at 3 p.m. How would you know that? People would rather feel guilty than helpless. And she called me about a week later and she said, my psychiatrist wants to know what you did to me. Whoa. Because I'm not depressed anymore. And she said, my friends don't recognize me. They don't know who I am. So there are times when even very quickly you can use hypnosis to help people deal with very severe traumatic problems.
Wow. How does your research and the science of hypnosis interact with what they're now studying with regard to psychedelic assisted psychotherapy?
Well, it's pretty interesting. There's something to it. There are people dying of cancer who seem to be helped in dealing with their fear of death, taking psilocybin and coupled with psychotherapy. MDMA seems to be helpful for PTSD. There have been good studies at Johns Hopkins and elsewhere on that. I think what they do is they affect the serotonin system, which is involved in depression, but also active in the default mode network. And it changes your conception of who you are, what your selfhood is, like hypnosis does in a very transient way, but this does in a rather profound way. So, people say, I experience things, but not as my usual self. And so people on psilocybin who are dying of cancer say, I see that this illness is likely to kill me, but I also see what a precious thing having been able to be alive at all is. And I'm grateful for that experience. It's like my breast cancer patients in the support group who would watch one another die would say it's like looking into the Grand Canyon when you're afraid of heights. If you fell down, it would be a disaster, but you feel better about yourself because you're able to look. I can't say I feel serene, but I can look at it. So I think both of these in different ways help people kind of reconnect with who they are and with aspects of their selfhood that they kind of overlooked. And so I think they're both can be very valuable, and the psychedelic assisted psychotherapy is a very interesting and rapidly developing area.
How can healthcare practitioners help, like, to support your work, to help help this gain wider adoption within the medical establishment?
I train doctors. I've been doing it all my life, but it is harder to do. It's not very hard, as you can see, but it's harder than writing out a prescription. And I used to think the way to do it was to train a whole lot of doctors to do it. And I've changed my mind about that. I love it when docs want to learn. I continue teaching it. But I think there's enough about it that we can just put in the hands of patients with their smartphones that let them learn to do it. So all you need to do is say Reverie, Reveri, download it from the App Store and try it and see what happens. And there will be some people who need the benefit of full-on professional assistance doing it as a treatment, but it's just learning a skill. You can get pretty far very rapidly by just referring patients to Reverie.
Super cool. So what is your day to day? Are you in clinic now, or is it mainly education?
I'm a research psychiatrist, so I have a research lab, and the majority of my time is spent doing research. But about 5 hours a week, I see patients. I'm about to head off to my office and see a couple of patients.
Wow. And
so I do that too, and I teach, but I'm full-time professor at Stanford.
Oh, so cool. Well, this was, super, super interesting. What about in this, I'm just curious before I let you go, in the setting of like neurodegeneration, age-related disease, things like that, like dementia.
Well, dementia, that's more difficult. And I think part of what happens with dementia is people lose control over how their brain is working, and they have trouble remembering new things in particular. And so teaching them something new becomes much more difficult. I'd say if people have learned before they got demented, they're more likely to hang on to some of those skills as they get demented. But I'd start learning it early because it's harder to teach people with dementia new things. It's more management and support.
Yeah, sad. I'm very interested in dementia from multiple avenues, but super cool. Well, I'm really grateful for your research, and
Thank you.
And I look forward to trying out the app. I mean, that was a super fun and interesting and kind of mind-blowing exercise that you walked me through.
Great. How are you feeling? You still feeling good?
Yeah. I mean, I remember when you asked me about my back pain, I was feeling back pain, and I'm not feeling any back pain right now still.
I love it.
So yeah.
I love it. Well, listen, wait till you get my bill. No, I'm just...
It's in the mail. Hey, if you like that video, you need to check out this one here, and I'll see you there.